I've been to several parts of the world and Africa. One of the biggest problems is, when you're sick or when you have a medical problem, going to the health center becomes an issue because you don't have the money. So for me, looking at a child somewhere in a rural area who can go to a health center and access care without having to think of the cost. This is, a turning point is really remarkable. You will recall that Rwanda went through difficult times in the 90s. And coming out of this difficult time, the country has said, look, we really want to create a community where everybody has a good access to healthcare, good access to the basic services such as water, sanitation. So WHO looked at it and said, look, we need to develop a system that will ensure that we remove the financial barriers. So one of the key issues at the time was that a lot of the people are in the informal health sector. Whereas if you look at most of the health insurance scheme, they were focusing on people who are working. So government decided to create the different categories called Ubudehe. This Ubudehe classifies people according to their socioeconomic status. And that helped the government to know who needs assistance and what level of assistance that they need. And then the community-based health insurance scheme was rolled out. We have a coverage of over 80%, which by African standard or by any standard, it's a very remarkable story. And we feel that we can go to 100%. We're looking at how can we put in place a system to get more people to register. Apart from having full coverage of everybody, we're looking at the service provider. How can we help them to improve their quality of care and how the services are priced? As a medical professional, that gives me a lot of joy. Working for WHO, being able to serve the people of Africa, being able to serve the people of Rwanda, moving from a very difficult situation into something that now has become a gold standard on the continent.